Go.
Jessica, your respiratory therapist. And we're going to do a check-off. We're going to do trach cares and suctioning and ABGs. We're going to do all of them. We're going to do a whole file swoop here. Okay, so I'm going to go in the patient's room, introduce myself, explain what I'm going to be doing. Okay, so hey, this is Mr. Gonzalez, Mr. Speedy Gonzalez. Hi, Speedy Gonzalez. I'm Jessica. I'm here to do some trach cleaning. Can you tell me name, birthday? Blah, blah, blah. Okay, great. Let me get your vital signs real fast. Pulse and respiratory rate. Vitals. Okay, good, good. Pulse is high, so is your respiratory rate. So we'll see if we can suction, see if it comes out a little bit. So to start our section, we're going to gather our materials. I have my backup backup trach, backup suction catheter in case it gets contaminated. I'm going to oxygenate them first. So I'm going to turn on my oxygen over here. That's the air, it's oxygen. Set to 100. I'm going to hook the mask onto this trach. I can't get the thing back in, so we're just going to pretend it's on there. Okay, so we're going to set that. It's on 100%. 10 right here, so we're going to hyper-oxygenate him while that's going. I'm going to make sure everything's set up. I have my vacuum set up. Pressure set. My suction. This thing called canister. Yeah, suction thing. Here, I'm getting a suction kit. I'm just going to open this. Which in real life I wouldn't touch this because it, but we're pretending. There you go. And this is going to be both my suction water and my hydrogen peroxide solution, so I'm more pretending. Here is my tracheostomy care kit. I'm going to put that here too. Open, ready to go. I'm going to take an ABG. I'm going to do that after I'm done, so I have that also open, ready to go over here. Okay, so he is oxygenated, so I'm going to start my vacuum on. The pressure is just 120. Like that. And we're going to start our suction. So at this point, I'm going to just our gloves. Take these off. This gloves, but oh, I broke it. Okay, I'm just wasting the gloves. Throw those away. Okay, so now we're going to sterile gloves. Touching these sides only. Okay, this hand is my sterile hand. Touch nothing but the calf. Where's my phone? That one, right? Okay. All right, there we go. Okay. Always with the difficulties. Okay. Okay. Clean hands, so I'm going to pick this up. And once I pick this up, touch nothing else. Okay. That is ready to go. So we're going to unhook the oxygen now. Right there. Alright, we're going to test our suction, make sure it works. It is. Alright, now we're going to suction. Put it in. I'm going to push down until you hit it gently. So you hit resistance. Correct. There it is. Pull back a little bit and suction. I'm going to pull it out and we're going to pull and breathe. Pull and release just like you're breathing. No longer than 15 seconds. Of course, the trach, so it's really close, so it'll take that long. Okay, there we go. We're going to rinse that there. Alright, and that is done. Turn it off. And unhooked. Alright. So the suctioning. I'm going to put the oxygen back on just in case. Because if the stir it was high when we started, I don't want to make it any more hypoxic than you might be. So put that on just for now while I clean this out of the way. Okay, so now we're going to clean the catheter. Tracheotomy. You know what I'm trying to say?
Yes.
Yes, you know, the thing, the trach, right? Here's my kit. This is peroxide now and saline, sterile saline extract. And here's my kit. I got Q-tips and my gloves, gauze, like a surgical thing. Okay, so we'll work on that. Off that way. Okay, so we're going to move the gauze very gently. We don't want to move this. Might hurt. So take the old gauze, and we're going to pretend it's dirty and throw it away, but really we're going to use it again. Isn't there? Okay, so to clean out from underneath the trach, you take Q-tip and dip it in your solution. You swipe away from it, and then throw it away. And then get a new one. Ta-da! Repeat. Other side. Here. You want to pull out like that. Throw it away. New one, dip, kind of go around, keep doing it, go out like that. And repeat, so what you do with the Q-tips. And then you would change the cannula. This does not have an inner cannula, but if you did, you would remove it and throw it away and get a new one. After you removed it, you want to clean out in here in case there was any gunk, so you would take this and clean and get all the gunk out, and then you replace it with the new cannula. You have your backup. In case anything goes wrong, if it starts to, the new one doesn't work, if it's occluded, if you take it out right away, if you need to replace the whole thing, you can. And then you want to replace the gauze. This is new gauze, not the old gauze, I promise. Hold that in place and move it in there. Keep it nice and clean. Get the pilot balloon out. Same on the other side. Hook if you need to, but don't move the. Okay, there we go. That's in there. If these were dirty, you can change these, but we don't need to. We're going to do this, make sure they're tight, but not too tight. So you want to make a finger length in between. So that's kind of like that. So it keeps it in place, but not so tight that it hurts him. And there we go. I'm going to grab pulse on him again real fast. Get over there. Check respiratory rate. Oh, this thing, well, yeah, do you want to check? This doesn't have a cuff. If it did, you would inflate, check the pressure. See, I'm going to hold it right there. Yeah, but this does not have a cuff. If you did, I'd do that. This is a cuff. Inflate cuff slowly. Yeah, it's called a cuff leader. And you can, basically you want to keep it 20 for comfort and to stop any leaks and reduce risk of damage. So it's taking a pulse. Thank you for interrupting me. Taking a pulse, it's still high, and his respiratory rate's still like 30, so we're going to do an ABG on him and go down there and see what's going on. I'm also going to put oxygen on him again. See if that helps bring it down a little bit. I would tie that, but I can't. Okay, so I did ABG. Does he have an arm? He doesn't. That guy's an arm. The other guy has an arm. We'll use that. So I'm going to bring my little ABG kit over. It's been opened 100 times because it's the one I've been using all quarter, so just pretend it's a new one. Okay. Is it on? I can't really tell. I can pretend. Okay, so open that. Oh, it's iodine. Oh, it's alcohol. Okay. Well, you know what? Pretend this is alcohol wipe. Okay, done. Okay, so everything's open. Fill out my label. There. Okay. That's why you pull back. Okay, but yeah, like I said, I would pull it back. Mix heparin up. Get that ready. Okay. So, first I'm gonna get pulse. Right there. There's that. I'm doing the Allen thing. Since he's pretend, I did it. Yeah, he's good. Okay. Allen thing's good. So now I'm going to alcohol. It's an alcohol wipe. Don't forget alcohol, 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 alcohol. Circles away from the. Alright. Two. Double up. Okay, so I'd probably position him so I could sit or be down here, but pretend land. Yay, mannequin. Okay, so I'm looking for pulse, artery, got it. Okay, so now I'm holding it. I try to imagine the pathway of the artery. I might lift this finger up and secure it with this finger. I'm going to insert 45 degrees, boom, stick it in. Ah, it goes in, boom. There we go. Hey, I'm gonna pretend I got it. I got it. See, it's filling with blood. Big old, yeah, this guy has clear blood. So it's filling up, yep. Just gonna fill it, fill it, fill it. All right, done. Hold it, my ABG. I'm gonna stick it in that red thing, but I can't because I'm, you know, can't use it. It's like a 20-minute video. You know how it goes. Okay, and it goes, ding, here's the lid, double bag, off it goes. Okay, forget that. You know how that goes. This goes on, okay, double bag. Anyway, so 10-minute video. There's my ABG. I've done like the 15th check off. I'm done now. Okay, anyway, so let me take this off. Okay, we're gonna send this down to the lab. Check one more time. Let's come down a little bit, so. Okay, off to the lab we go. I'm done. Hopefully I do this right. Okay, bye.